privilege to welcome you all to the White House's first regional forum on healthcare reform. I'm so pleased that we've been joined by a couple of very important leaders in this effort. We know that the upper Midwest has been particularly hard hit, especially by the losses of manufacturing jobs. So pleased that we are joined here by Governor Jim Doyle, who's been a tremendous champion in that effort in Wisconsin. I think there are a few Wisconsin citizens here as well, and we're glad to be able to welcome them also. We're also so pleased to be able to welcome the Chief Policy Honcho for the Obama administration, Melody Barnes. Melody, actually, I'm so pleased to tell you all that she graduated from law school at U of M, so she's an honorary. But Melody, as if you saw the forum that was at the White House last week, Melody has been in charge of this dialogue and in making sure that the Obama administration hears from us, and that's what this is all about. So I want to thank all of you who are here, because we have real people here. We have regular citizens and we have stakeholders in the sense of people from the healthcare community, people from the business community, and everyday citizens who feel the burden of the cost of healthcare or the burden of not having access to healthcare every single day. So I want to thank you all for participating in this discussion. We're going to get right to it in just a minute, but before I do, I just want to set the stage from Michigan's perspective. Michigan, as we all know from Michigan, is the poster child of why reform needs to happen. We are the state that's been hardest hit by this economy because for 100 years we've been the proud leader in the manufacturing/automotive industry. We know that this economic crisis rests upon a number of different causes, but we also know that in order to emerge, healthcare has got to be a critical component of the solution. For us in Michigan, we know that the fine vehicles that we manufacture, embedded in every one of those cars, is a $1,200 to $1,600 premium that is reflective of healthcare. This is a competitiveness issue, and if you don't believe me as governor, today, the Business Roundtable, which is a national organization of CEOs from the business community, are saying that healthcare is a competitiveness issue, that we as a nation spend far more on healthcare than some of our competitor advanced nations, and yet the outcomes that we have are not as successful. We can do this differently, folks. We can do it better, and that's what this discussion is all about. What is important to you as citizens? What can we tell the Obama administration that we want them to take into consideration as they lead this charge to reform healthcare in our country? It's a privilege to be the first place where this is housed, where the experiences of citizens can be communicated to this new president, who I think has been doing such a phenomenal job in leading our country. And this issue of healthcare being next up on deck, I think only solidifies, those of us who believe that healthcare reform is a necessity, only solidifies our opinion of the greatness of this administration. I know it's supposed to be nonpartisan, and this is a bipartisan crowd, but I had to get that in there because it's very exciting for me as governor to be able to be the place where this first forum is able to welcome the White House. So with that, I'm going to turn it over to Governor Jim Doyle from Wisconsin, and then he's going to turn it over to Melody Barnes, and then I'm going to ask just very briefly our great representatives from Congress who are here, Representative John Dingell, Representative John Conyers, to say just a brief word before we start asking you questions, okay?